I want to introduce myself. I'm Dr. Rita McGuire. I am an obstetrician gynecologist. I'm one of the 4 co-founders of Wakana, as well as the chief medical officer here. And this is the doctor's edition. Tuesday night at 7 p.m. is really geared for healthcare professionals, physicians, nurses, nurse practitioners, chiropractors, dentists, veterinarians, doulas, all realms of healthcare, pharmacists, clinical psychologists are welcome on this call to really understand the difference between CBD and medical marijuana. So I am a graduate of Wayne State School of Medicine in Detroit, Michigan. I did my residency at Cook County Hospital. I'm CEO of RJM Wellness and Ripped Rita Fitness. Those are 2 of my companies, as well as I'm a global women's health and wellness speaker. I'm a certifying physician for the medical marijuana program here in Illinois. In fact, I certified the very first patient in the opioid exchange program in Illinois. I also testified in front of the Judiciary Committee for the taxation and legalization of adult use cannabis. So the governor here in Illinois asked me to speak and to give my opinion, expert opinions and research about the use of cannabis. And so we are the 11th state to adopt cannabis laws for adults. I'm also a member for Doctor for Cannabis Regulation. And as I stated previously, I'm one of the co-founders and chief medical officer for Wakana for Life. What I'm super excited about is that we have a medical advisory board here at Wakana. We have a board of healthcare professionals that not only recommend our products to their patients, but they utilize these products themselves. They recommend it to their family and to their friends. And so this medical advisory board helps to really dig into research, helps and very instrumental in our conferences, and really helping our distributors and our customers to understand how CBD works. So the medical advisory board is made up of MDs, of registered nurses, as well as nurse practitioners. We have chiropractors, we have dentists, we have pharmacists, we have naturopaths, and we also have those clinical psychologists as well. So we have a full range of medical professionals here at Wakana. So really, it was my colleague, or is my colleague, Dr. Sanjay Gupta, who really brought to light the medicinal benefits of cannabis. In fact, in 2013, 2014, Dr. Sanjay Gupta had to come and make a public apology about what he had said in 2009, and that was no to weed. Absolutely, cannabis has no medicinal benefits. In fact, it can be a very dangerous drug, and it has a very high safety profile. But in 2013, 2014, he had to come back and really make a public apology and said that I didn't dig deep enough. I didn't do my due diligence and really travel the world and talk to medical experts in other countries. I didn't even talk to patients who have had relief when they utilize the cannabis plant. So Dr. Sanjay Gupta is really instrumental in bringing cannabis mainstream. So when we look at the cannabis plant, Cannabis sativa has 2 main species. One is marijuana and one is hemp. Well, many of us know that the marijuana species gives us the high, the euphoria, the paranoia, and even the munchies. But it's the hemp species that gives us the health without the high. Well, you may ask, Dr. Rita, how does that work? Well, marijuana has very high levels of delta-9 THC. So does hemp, but it has THC in very low levels. And by definition, the species hemp is defined as containing 0.3% or less of THC. So 0.3% or less of THC will not get anyone high. So that's why we refer to hemp as the health without the high. So again, two species. One gives you the high, that's marijuana. It has high levels of THC, and one gives you the health. It has low levels of THC. But what's interesting is that both of these species do contain CBD or cannabidiol. That's what we're going to talk about this evening is CBD. And all of our products here at Wakana obviously are sourced from the hemp species that contains less than 0.3% of THC. So when you go into your local dispensary and you either have a medical marijuana card, or maybe you don't have a medical marijuana card, so you go into the dispensary as a recreational client, those products in that dispensary are sourced from marijuana. So those products will give you a high, they will give you a buzz because they have higher levels of THC. So when we look at other features and differences between marijuana and hemp, we see that they phenotypically look different, right? The marijuana plant is typically a plant that's shorter, it's stubbier, it's more of a bush. And the hemp species is typically taller, it's leaner, right? And so when you go on a farm and you're trying to tell the difference between marijuana and hemp, they clearly phenotypically look very, very different. So what makes CBD legal? Well, the 2018 Farm Bill, which was passed by former President Trump, allowed hemp to no longer be a Schedule 1 drug. So yeah, hemp used to be a Schedule 1 drug up there with LSD and cocaine and other very harmful drugs. It was removed from the Schedule 1 drug. So now CBD is legal in all 50 states to consume, to cultivate and grow, and even to sell. So under the 2018 Farm Bill, now we can do a lot of research. In fact, you see a lot of research being done at top institutions like UC San Diego. They're doing research with humans now, utilizing CBD and looking at its effect in ADHD and eating disorders and seizure disorders and many, many other conditions that we can now use therapeutically for a lot of conditions. So yes, hemp is now removed from the Schedule 1 drug classification and it is legal. Now, the only FDA-approved CBD prescription is called Epidolex. Epidolex is a medication that's used in children to treat their seizures. Either they have Lennox-Gastaut syndrome or Dravet syndrome or tuberous sclerosis complex. But what's interesting about this CBD FDA-approved prescription, its cost is $3,200 a month. And what's interesting about Epidolex is that it is derived from the cannabis sativa plant utilizing CBD, but at a very, very high cost. There are other medications that are approved by the FDA, like Syndros. A lot of these medications are THC derived, so they're derived from the part of the plant that gives you the high, but again, they're utilized to increase appetite in those who have cancer or HIV/AIDS, but their costs are up there as well, $1,400, $1,500 a month. Marinol is another THC-derived FDA-approved prescription, again used for very severe debilitating pain for those cancer patients who have metastasis and or those patients who have issues with their appetite. We have Sesamet is another THC-derived medication that, yes, a physician can write a prescription for their patients at a very, very high cost. And then Sativex. Sativex is not approved in the US. It is approved in the UK, but it is a 1-to-1, 1 THC to 1 CBD derived medication, again, used in patients with cancer, patients who have very chronic debilitating pain due to cancer. So why is it that though CBD is so popular in the US now? Because it is mainstream. All of our patients are asking, they're inquiring about CBD. Well, it's because so many patients are sick and tired of being on multiple medications that are really not addressing or really solving their issues. You know, the average 50-year-old is on about 5 to 7 medications. The average 70-year-old is on 10 to 12 medications. So patients are just sick of side effects and they're sick of taking medication. So CBD as a healthcare provider is not to replace their medication necessarily, but CBD can be used as a tool, another tool in their toolbox for an alternative that's holistic and organic. So these are some of the top reasons that folks use CBD: for relaxation, for stress, anxiety relief, to improve sleep, to relieve muscle pain, to relieve chronic pain, to relieve joint pain, for social use, to treat migraines, to offset nausea, spiritual use, as a novelty, for skincare, menstrual relief, sexual enhancement, and to treat seizures. And what we see is that the baby boomers, folks in my age group, are really utilizing CBD a lot, as well as the Gen Zs and the millennials. See, the millennials understand that they can now utilize a product that won't get them high, that will allow them to work and reduce stress and anxiety, improve their sleep without having to utilize marijuana. Nurses, so many nurses are on board. We have at least 20 nurses on our medical advisory board. You know, nurses understand that this is, again, a tool in the toolbox that can be recommended to their patients, as well as doulas. You know, doulas are a very big part of the area that I work in OB-GYN, and doulas really help that women during labor, prenatal, as well as postpartum. And yes, CBD can be utilized topically. In fact, we have a distributor whose daughter could not get an epidural during labor, and so she used our topical pain cream on her abdomen to help to ease those contractions. So let's look at CBD a little bit more closely. CBD is an abbreviation for cannabidiol. And CBD, as you can see here, is really the main player when it comes to the compounds that the cannabis plant can make. It can help to reduce bacterial infections. It's antibacterial. It inhibits cancer cell growth. You're seeing a lot of oncologists using CBD to reduce nausea and vomiting, as well as to help with those debilitating joint and muscle pains that a lot of their patients have when they're going through chemotherapy and radiation. CBD is neuroprotective, so you're seeing a lot of neurologists utilizing CBD for their patients who've had either seizures or they've had neurodegenerative conditions or even conditions like strokes that have caused nerve damage. CBD promotes bone growth. You're seeing a lot of orthopods utilizing CBD in their practice in those patients who have had fractures. CBD reduces seizures and convulsions. It reduces blood sugar levels. So your internal medicine, your endocrinologists are utilizing and seeing a lot of therapeutic modalities where it can help to reduce blood sugar levels. It helps to reduce inflammation and pain. That's like the #1 reason that folks seek to use CBD is for pain and inflammation. It reduces the risk of arterial blockage. Lots of cardiologists are looking at CBD to help reduce atherosclerosis and coronary artery disease. It reduces small intestinal contractions. A lot of GI doctors are utilizing CBD to help reduce symptoms due to ulcerative colitis and Crohn's disease, as well as it reduces and suppresses muscle spasms in those patients who have multiple sclerosis. And it also helps to reduce symptoms due to psoriasis and eczema and acne. A lot of dermatologists are utilizing CBD on their clients and patients who have skin disorders, as well as CBD is a vasorelaxant. So it helps to dilate those vessels, improving blood pressure. We see there are other cannabinoids too, like CBG and CBC and delta-8 THC and delta-9 THC. All of these cannabinoids work synergistically on a cellular level to really give the relief that folks are looking for. So that's why when we talk about our full spectrum product, we don't want just one cannabinoid. We want the synergy of all of the whole plant working together. Our body also produces cannabinoids, just like the plant. The plant, they're called phytocannabinoids, but our body produces what we call endogenous or endocannabinoids. Now, endocannabinoids are very important in keeping our body in balance. And when we get stressed, when we have a poor diet, when we're not hydrating, when we're not sleeping, these endogenous cannabinoids become deficient. And when they become deficient, that's when disease states occur, like migraines and fibromyalgia and depression. All of these disease states have been linked to a deficiency in anandamide and 2-AG. And what's fascinating about these two more common endogenous cannabinoids is that they're found in high levels in breast milk. That's why breastfed babies are so happy, right? Their immune system is so strong because they're receiving from their mom endogenous cannabinoids. They're also anandamide and 2-AG are found in high levels in dark chocolate. That's why when you eat dark chocolate, you feel so good, as well as beer hops. So these endogenous cannabinoids, along with the phytocannabinoids that you're consuming in CBD products, are what keeps us in balance, what keeps us in homeostasis. And that brings me to, well, Dr. Rita, how does CBD work? You know, as healthcare professionals, we want to see the science. We don't want to think that we're offering like a snake oil or a magical potion to our patients or our clients, but the science behind how cannabis works in the body is fascinating. In fact, it was discovered in the early 1990s when I was at Wayne State School of Medicine. Now, I wasn't taught this in medical school. In fact, only 13% of medical schools are teaching this to their medical students. So the human endocannabinoid system is a very vital regulatory system. It's a system that regulates our mood, our sleep-wake cycles, our metabolism, our blood pressure, our pulse rate. And this system is found in every human being. Every vertebrae has an endocannabinoid system. It's made up of two main receptors, CB1 and CB2. And these receptors, as you can see on the slide here, these receptors are found in every single organ and gland in our body, from our head to our toe. So when you think about consuming cannabis, when you think about all these receptors that are looking for cannabis, this is the reason why when you consume it and you're stressed out, or you consume it and you have pain, or you consume it and you can't sleep, or you consume it and you have symptoms due to diabetes or hypertension, or you utilize it topically on your skin because you have acne or eczema, This is why it works. These receptors bind to the cannabis compound and send signals to different areas of the body to release, to reduce inflammation, stress. It helps to work in pathways that help to reduce depression. They work in pathways to help reduce symptoms of fibromyalgia and other autoimmune conditions. This is the science behind how cannabis works, and it's fascinating. Now, there's some other things that healthcare professionals should think about and know about CBD, is that CBD is metabolized through our liver through a special pathway, CYP450, like many other medications. And this is why CBD can negatively interact with other drugs. Now, the two main drugs that you should know about as healthcare professionals is Coumadin and warfarin. The other medication is theophylline. Now, theophylline is not used that much in medicine. It's for asthma, but Coumadin and Coumadin or warfarin is. Now, this can cause either an inhibition of medications that your patient may be on, or it could potentiate the medication that the patient may be on. Now, it doesn't mean your patient can't take CBD if they're on warfarin or Coumadin, or if they're on theophylline or some other medications that, of course, many medications are metabolized in the liver. It just means specifically in the case of blood thinners like Coumadin that you have to monitor your client, your patient, a little closer. You may have to get that INR a little bit more, draw that INR more frequently. So those are just some of the few interactions that CBD may have with other drugs. Another big concern is, will CBD show up on my drug tests, right? Our patients are always wondering that, and we don't want our patients to lose their job. So there's a lot of research about that. One thing is that topical products, especially those out there that own med spas and they're doing massages or they're doing facials, well, topical products will not pass through the blood-brain barrier. So you can use topical CBD products that are full spectrum products and absolutely reassure your client that they will pass their drug screen. Now, there was a lot of studies done on those clients that are using a full spectrum product. When I call a full spectrum, that's a product that utilizes all of those cannabinoids that you saw in that chart: CBD, CBC, CBG, Delta 9 THC, Delta 8 THC. Well, when you're looking at a full spectrum product, there is a potential of that full spectrum product showing up in your clients or your patients' urine drug screen. And the research and the sources that I've found is that it will take very large doses, between 1,000 and 2,000 milligrams a day, to have an 11 to 23% chance of detection in the drug screen. Well, we don't want our patients, our clients, to lose their jobs. So we offer a broad spectrum product. That is a product that contains less than 0.0% of THC that can safely be used as a gummy or a tincture in those who want to utilize CBD and also keep their job. So the thing about urine drug screens, by more employers use, or what we call a rapid point of care drug screen. Well, those drug screens are not very sensitive or specific. These drug screens that are those you find at Walgreens or CVS, they really don't have the sophisticated technology to understand if that cannabinoid they're picking up is CBD, is it THC, is it CBC, is it CBN? So I recommend that when you have clients that may undergo random drug screens, that you recommend that that client requests that their employer send them to LabCorp. I do know that LabCorp has a very specific and sensitive urine drug screen that can pick up if that person is utilizing CBD or is utilizing THC. The other thing you need to know is, where does the biomass, where does the raw product, where does the hemp come from that's in that bottle, right? All of our products are sourced from hemp farms that are growing hemp organically. Those farms are in Oregon, they're in Colorado, and California. See, hemp is a bioaccumulator, meaning that when you put hemp and you're growing it, it will accumulate whatever in that soil. So if there's pesticides, heavy metals, toxins, mold, mildew is in that soil, guess what? It's going to be in that product. And if you're dealing with a client, a patient who's immunocompromised, that client that may have HIV/AIDS, that client may have cancer, that client may have an autoimmune condition, and you're giving them or recommending a product that has mold, mildew, heavy metals, pesticides, it can be very harmful to that client or that patient. So our products are all grown organically. Our products are extracted through a very clean extraction process. So when our suppliers extract the oil from the biomass from the plant, there's several different ways you can do it. You can do it through butane or propane, which is not very good for the environment, or it's not a very clean way of extracting the oil. Our extraction method is a supercritical CO2 extraction method. Now it's more expensive, but it's a clean extraction method, and it doesn't leave any residual solvents like CO2 behind. We also have a certificate of analysis on all of our products. All of our products go through a third-party validation where we ensure that there's no mold, mildew, heavy metals, pesticides, residual solvents, any microbial toxic contaminants, and that the product is sourced from hemp and has the legal limit of THC. All of that is found in our certificates of analysis. So honestly, these are very crucial things as healthcare professionals, as those who are going to be recommending products to their clients. What kind of products are products that you should trust and products you should use? So again, it's a supercritical CO2 extraction method. It's the cleanest way of getting that oil out of the biomass. And then there are all different ways that your client, your customer, your patient can consume CBD. They can use an oral application, which is called a tincture. They can use a smokable. They can use a vape pen or a smokable CBD joint. They can use a water soluble. They can use edibles like gummies and spices. They can use capsules, and they can use topicals. These are all different ways that CBD can be consumed. Now, when you look at the science, because many of you are nurses on the line, you're healthcare professionals, a lot of research is found through PubMed. And again, since the 2018 Farm Bill has been passed, you're going to see a lot of top research institutions doing research with humans and not rats and mice and piglets, right? As it relates to CBD. So a lot of research has been done on using cannabinoids in the management of difficult to treat pain, like your neuropathies and your sciaticas. Cannabidiol CBD used as a potential treatment for anxiety disorders. A lot of research looking at using cannabinoids in cancer treatment, utilizing it for nausea, vomiting, and difficult to treat pain as well. CBD being used in GI disorders, like your ulcerative colitis and your Crohn's. So lots and lots of research out there. In fact, there's 23,000 peer review articles as it relates to CBD and its use. So I want to quickly go through some of our product line. Our product line is really superior. We are very unique in the CBD market space because we enhance our CBD products with proprietary formulas where we're utilizing essential oils to even enhance the medicinal benefits that CBD offers. We have a power line, so if you see any of the products with the black label, that means those are full spectrum products that contain the legal limit of THC. And then we have our pure line. Those are these products here in the white labels, and they are our broad spectrum products that contain less than 0.0% of THC. Those are the products that can be utilized for those who have random drug screens. Now remember, the topical products, which are all power, can be utilized because they're topical. Topical products don't pass that blood-brain barrier and can be utilized safely for those who have random drug screens. This is an example of what our certificate of analysis looks like. They're super easy to read. I know the font is very small, you probably can't see them, but every product has a certificate of analysis. It's a pass-fail on all of the other categories like pesticides and mold, mildew, residual solvents, microbial content, all pass. And then there is the potency. The potency will give you what the third-party lab has deemed the milligrams, what's in the bottle, as well as the percentage of THC, less than 0.3%, and also the terpenes. I failed to talk about the terpenes, but the terpenes are what give the plant its aroma, its ability to also have medicinal benefits on the body. So all of that is in our certificates of analysis. So here at Wakana, we offer smokables, we offer tinctures, we offer topicals, we offer edibles, we offer hair care and skin care products. We offer products for sexual health. We offer essential oils, and we also offer sanitizing products for your home and office. The FDA disclaimer, have to read this, that these statements made regarding these products have not been evaluated by the Food and Drug Administration. The efficacy of these products have not been confirmed by the FDA-approved research. These products are not intended to diagnose, treat, cure, or prevent any disease. The FDA does not allow us to make any claims, but what we can say is that these products can assist or address your symptoms due to arthritis or migraines or lupus or fibromyalgia or psoriasis or acne, right? So all information presented here is not meant as a substitute or an alternative to information from your healthcare practitioners. Please consult your healthcare professional about potential interactions or other possible complications before using any product. The Federal Food, Drug, and Cosmetic Act require this notice. So let's look at our tinctures. Tinctures are oils that you put underneath your tongue. The recommended dosing is 3 drops twice a day. Now the power line, again, is in the black label. The pure line is in the white label. Those are for those who have random drug screens at their job. We also have in our product line a water-soluble product. So this is a great product that you can add to your water, your juice, your smoothie. I recommend the Power Water Soluble also for those grandmas and grandfathers, or maybe elderly parent that has dementia and they don't have the cognitive function to hold a tincture under their tongue for a minute before they swallow. So just drop some drops in their water, in their smoothie, and keep it moving, right? It can really help those with dementia to assist with those symptoms of irritability or inability to sleep, and to really help them to be calm. We also have a more therapeutic product. It's called Hemp MD. That is our highest potency CBD product. It's 900 milligrams in a 15 ml bottle. The other products are between 300 and 500 milligrams. So Hemp MD is for that person who has some pretty severe challenges going on and they want to address it. We also have a hemp-powered hair. Hemp-powered hair is for those men and women who are losing hair. They're having a lot of shedding. They're having the aftermath of traction alopecia, where they've been wearing braids and weaves, and this has taken their hair out. But this is a product that can be used as a tincture under the tongue. But if they have random drug screens, they can use it topically right in the area of concern on the scalp to help assist with hair restoration. So those are some of the benefits of our tincture, being that we've enhanced our tincture with peppermint, with turmeric, with black seed. These are very powerful essential oils that help to not only improve digestion, but black seed is used in a lot of hospitals to address methicillin-resistant Staph aureus. Black seed has also been shown in research to rebuild the beta cells of the pancreas. So your type 1, your type 2 diabetics that are insulin resistant can really get some benefit from those beta cells to regenerate and to be productive again. Our topicals, again, are for local relief. That sore knee, back, shoulders. You've got a headache, you want to take some of that topical and put it right at the temporal area. You've got a lot of athletes that are using our topicals, myself included. I work out every day. So I'm using that Extreme Power Pain Cream. That's our #1 selling topical here at Wakana. We also have Dr. Rita's Rub. It's a liquid relief in a roller ball. So I like using the Dr. Rita's Rub during the day because it's very portable, and at night I like to put the cream on so it really sets in to help relieve those sore, achy muscles. We also have something called our Holy Glow. It's our CBD facial serum. We have a facial serum, we have a facial mask, and we have a moisturizer that utilizes CBD because the skin is the largest organ in our body, and there are receptors in the skin to help reduce bacterial, to help reduce inflammation, and to really aid in the collagen construction to reduce wrinkles, so anti-aging. We have our body creams and body lotions. Again, the skin is the largest organ. So we have our Power Body Mango Cream that helps to restore those dry hands. We're all still washing their hands a lot during this global pandemic. We have our body creams that are enhanced with CBD and lotus and hibiscus. So we've got a lot of great topical products. Our edibles can't stay on the shelf. I'm telling you, my children fight over these gummies, right? These gummies are our full spectrum or our power gummies. We have our broad spectrum or our pure gummies for those who have random drug screens. And then we have our Delta 8. Delta 8 are loved by millennials. Oh my God, Delta 8 is a cousin of Delta 9. So all those millennials out there that love that buzz from Delta 9, well, Delta 8 is just a more potent CBD, and it's legal, but it also causes that millennial, even that baby boomer, to increase creativity. It gives a more potent response on a cellular level for those who are having symptoms due to arthritis or any inflammatory condition that causes pain. And then we have our King of the Jungle gummy for all those men and women that have issues with libido. They want to increase their stamina. They want to address all of those concerns that can really affect the love life of partners. We have our Flat Belly Brew. Yes, we have a coffee that's infused with CBD, and it's infused with a broad spectrum CBD, so those who have random drug screens can utilize our coffee to help to improve their metabolism. If they're looking for weight management, weight loss, it will help reduce their cravings for sugar and carbs. We also have a Flat Belly Gummy. Our Flat Belly Gummy also helps to reduce cravings for carbs and sugars and really helps to turn that white fat into brown fat. CBD is known to turn white fat, the bad fat, into the good fat that increases the metabolism, that reduces the risk of metabolic disease like hypertension and diabetes, all of those metabolic disorders. So our edibles are incredible. We do offer some non-CBD products like our immune defense tea to improve our immune system, and our bitters, which is like our colon cleanse. It's a tea form that is very bitter, and it helps to detox the liver and the colon. We have essential oils. The essential oil that I want to make mention of is our First Defense. It's a proprietary formula of CBD and essential oils that is utilized as a nasal spray. We know that microbes, viral particles, and bacterial particles, where do they enter? Through our nose. So yes, we formulated a product that can be utilized to help with that, as well as to address those who have allergies and sinuses as well. Our smokable products are products that offer very fast relief. So within 1 to 3 puffs on your CBD joint, you are getting relief for any acute onset of anxiety, of pain, or maybe you are, just so afraid to speak in front of large audiences. You can use our smokable products to offer relief within 1 to 5 minutes. So we offer a CBD joint, which will be on our website momentarily. We offer a Delta 8 CBD joint. These are flowers that's already rolled up for you. And then our premium flower for those who like to roll their own CBD joints will be back as well. Just know smokables work very, very fast. We have products for those who love to cook. You love to cook, we have Garlic Fire. We have Flavor King, Chili Lime. These are all infused spices for your favorite recipe. We even have a vegan butter. Yes, a butter that you can bake and cook with that's vegan, that is enhanced with CBD. We have a Culinary Plus product on the far right. This is a product that you can add to your brownies and your cookies. Hopefully you're not eating all that fatness, but when you want to bake and cook, yes, we have a CBD culinary product that you can do that with. We also have a full line of hair care products. It's called Save Our Strands, SOS. We have shampoo. We have a moisturizing conditioner. We have detangler, a leave-in detangler. We have styling cream. We have our hemp-powered hair that I mentioned before, and even a product for men for their beards, all enhanced with CBD. Why? Because the skin is the largest organ in our body, and you have to maintain a healthy scalp to maintain a healthy follicle. So our sanitizers is our sister company. You know, when COVID hit, Wakana had to pivot. We had to pivot because we wanted to keep our essential workers safe. We wanted to keep our friends and family safe. So we use a special chemical called quaternary ammonium in our products. It is CDC approved for COVID-19. We have a hand sanitizer. We have a surface sanitizer. We have a produce wash for your fruits, your vegetables, and even your meat. So that is our sanitizing product line. And then our sexual health. I want to mention 2 products that I didn't mention with the King of the Jungle Gummy and our body butters, but that's our CBD Lube. You know, I deal with a lot of women who are perimenopausal, menopausal. They have vaginal dryness. Sex is painful. They don't want to have sex because they're vaginal dryness. Well, we have a CBD Lube that will help to address that issue. And it's topical, which means it will not pass through the blood-brain barrier, and those who have random drug screens can utilize our CBD Lube. It enhances the sexual encounter for that woman who may not have any vaginal dryness, but it absolutely can address that as well. We have recommended uses on all of our products. Start low, go slow. No one needs a lot of CBD all at once. So that's why we recommend 3 drops in the morning and 3 drops in the evening for our tincture. That's why we recommend between a quarter to half a gummy starting out. You don't want to get in the habit of eating all the gummies, because what will happen is that you'll have a side effect. You won't be high, but you may have nausea. You may have a headache. You may have extreme fatigue because you've taken too much CBD. More is not better. Start low. You can always increase that dose. So we have, again, products that can assist and address symptoms due to diabetes. You can't make claims and say, if you take this, your diabetes will go away. Absolutely not. But we do have recommended dosing for symptoms to address different chronic disease states, as well as for cholesterol. See, the Mayo Clinic already did their research, and they found in their research at the Mayo Clinic that most people don't need more than 2.5 to 20 milligrams, maybe 50 milligrams a day. So more is not better. So we have so many great choices. You can't go wrong here at Wakana. These are products that you can trust. These are products that are tested. These are products that come with certificates of analysis, and these are products that work. And that's really important. These are products that work. So I want to thank you for attending. If you have questions, you can email me at ritamd@wakana.com, ritamd@wakana.com. We do have a couple of minutes for questions. If you have a question, you can put it in the chat. But if you want to hear more about our company, if you want to hear more about the product line, if you want to hear more about the leadership and the co-founders and our vision and our mission here at Wakana, you can join the next call at 8 o'clock. There is a Zoom ID. You can screenshot this if you're interested in joining that 8 o'clock call. There is a passcode, and you can join that call as well. So I'm going to stop sharing. If there's any questions, you can put it in the chat. I do know that I have a couple of guests on the line. I have a couple of doulas on the line. I have a couple of nurses on the line. If you have any questions, you can put it in the chat. Let's see here. Diana says that she has a customer who is suffering from emphysema, interested in the pure products that may help reverse or give some relief naturally. I suggest our pure gummies, 900 milligrams, and our pure hempranium under the tongue, 3 drops twice a day, but told him that I would check first with our medical team. So great question, Diana. So what you want to make sure is that you want to watch the language you're using with someone that has any chronic condition or medical condition. Using words like may reverse is kind of borderline, not compliant with what the FDA wants us to say. But we have products that can assist or address some of the symptoms that this person has that has emphysema. So emphysema is a very chronic, debilitating lung disease. And typically with people who have emphysema, some of the symptoms they have is shortness of breath. They may have an inability to really get a good night's sleep because of the shortness of breath. They may have discomfort in the chest area. So I would recommend for that person to have our topical. They can either do the Dr. Rita's rub, or they can do the Power Extreme Pain because they have discomfort in the chest area. I would recommend, if they don't have random drug screens at their job, I would recommend the Power product instead of the Pure. I would recommend, like you said, the tincture twice a day, 3 drops. I would recommend the gummy at night, the Power gummy at night. And I would also recommend For any acute onset issues, I would highly recommend our smokable. Our smokable would be a great option to give them very acute relief, fast relief for their emphysema. And it may sound like a hypocritical thing to say for someone who has lung disease, but remember, when you utilize CBD in a smokable, there is no nicotine in it. There are no toxic chemicals. It is only medicinal byproducts of the cannabis plant that's helping to relieve the inflammation in the lungs. It's helping to relieve the anxiety that many emphysema patients have. So I would recommend the entire product line. The customer pack would give that person a huge savings where they would get all of those products at a 30%, 35% savings than buying it a la carte. So hopefully that helps. Let's see. You suggested pure because of work. Okay, good. So if the person is at work and has random drug screens, then I would recommend the pure gummies. I would recommend the pure tincture, and I would recommend the power topical. They would not be able to do the smokable because the smokable power, the smokables are all power products, and that product would get into their urine drug screen. Great questions. What regimen do you recommend for dementia? So for symptoms due to dementia, to address symptoms due to dementia, you hear my wording, right? You never want to give the person any false assumption that using CBD is going to cure their dementia, right? But what it will do is will help with the symptoms. It will help with the irritability that a lot of dementia patients have. It would help them to sleep, and it would help them to be less anxious. So for dementia, I would recommend the water soluble, because you can just drop it in their water and juice and they won't even know that they're consuming the CBD. It would be very hard for a patient with dementia to hold the tincture under the tongue for a minute, which you really need to do before you swallow so that it's really into the drugs in the bloodstream adequately. I would recommend also a gummy at night. I would recommend a power gummy at night. I would recommend the water soluble 3 drops twice a day. And I would also recommend at night the Power Extreme Pain Cream. And the reason being is that many patients with dementia have a lot of anxiety and they're always uptight. And by the end of the day, they've been so uptight that their muscles and trigger points are sore. So rubbing that patient down who has dementia with our Extreme Power Pain Cream will just help those muscles and those trigger points that are very tense during the day to be relaxed. So those are the 3 products: the Power Edible, or the Power Gummy, the Power Water Soluble, and the Power Extreme Pain Cream. Let's see. I think I answered all the questions. Wonderful. So if you are, again, a guest on the line, I want you to connect with the person that invited you on the line so that we can get your products ordered, we can answer any further questions, and we can also invite you to the 8 o'clock call, because on the 8 o'clock call, we talk about the business, the opportunity, helping you to understand that multiple streams of income are essential these days, right? So we talk about the opportunity and locking arms with us here at Wakana and becoming a business partner, as well as being a customer. So whatever you see yourself, whichever lane you see yourself in, that's what we talk about on the 8 o'clock call. So thank you so much for tuning in. Be well, be safe. I would love for you to tune in tomorrow at 8 o'clock, every Wednesday night. I do a different topic on a different condition, and I talk about more in depth these products that you can utilize. So we'll see you either in 5 minutes on the 8 o'clock call, or we'll either see you tomorrow evening, but please connect with the person that invited you so you can get to the next step. Be well, be safe, and good night.